HER2CLIMB was a phase 3 randomized clinical trial evaluating a HER2-selective tyrosine kinase inhibitor, tucatinib. This is a unique compound because most tyrosine kinase inhibitors thus far were promiscuous and hit several receptors, namely EGFR, which leads to toxicity such as diarrhea and rash. Tucatinib is also unique because it does appear to have good CNS blood-brain barrier penetration and early evidence of activity in brain metastases. In the HER2CLIMB study, 2/3 of patients received tucatinib combined with capecitabine and trastuzumab. 1/3 received capecitabine trastuzumab plus a placebo. The study reported very impressive results that were practice-changing in December of 2019 with a triple home run, really. They showed an improved progression-free survival in the overall population, an improved progression-free survival in the 50% or so of patients who had brain metastases, and an improved overall survival. This was all at the first reporting. This study was unique because it allowed patients who had active or progressing CNS metastases, and most studies will exclude these patients. In this study, over 170 patients had active CNS metastases. And at ASCO in 2020, the results of the central nervous system disease outcomes were presented and reported, showing that almost 50% of patients had their disease shrink or disappear in the brain in the tucatinib arm, which is a little more than doubling that compared to the placebo arm. Not only that, the progression-free survival and overall survival was significantly improved for patients with both active brain metastases and stable brain metastases. These data support the use of this triplet drug regimen in patients with or without CNS metastases. A lot of people talk about just using this regimen in patients with CNS metastases, but I'm actually very impressed with the survival benefits in patients with or without CNS metastases. Importantly, the tolerability of this triplet regimen was quite good. There was a slightly increased risk of grade 3 diarrhea with the addition of tucatinib to capecitabine, but it was not a huge number. It was on the order of 14% with grade 3. And we as oncologists are pretty good at managing diarrhea at that level with the use of antidiarrheal agents when needed. So in summary, I do think these data are incredibly practice-changing. They open up a new therapy for our patients. It is now FDA approved. I'm looking forward to seeing this drug combined with drugs such as TDM1 in earlier stage or earlier lines of therapy to see if we can prevent brain metastases.